the next pillar of success for NCLEX is developing your critical thinking. Okay? So how do you do that? How do you develop your critical thinking? You develop the critical thinking, one, by practicing questions every single day. You have to practice questions every single day. And I will share with you the Q banks that I think are the best. In a little bit, I will share that with you. But there's something called the key factors of an NCLEX question. So you have to identify these 5 key factors, and they are: 1, the client; the problem or healthcare needs; 3, subjective or objective data; keywords; and you need to identify if the question you're dealing with is a priority style question or a content question. So I want to use this example to show you how each of these key factors present on an NCLEX question. Now, you need to understand this. Are you going to see each key factor on every NCLEX style question? No. You could see 3 of the factors. You could see 1 of the factors or 4 of the factors, but you need to look for them. The first one is the client. So in this question, where is the client? Well, is a woman, or who is a client? Is a woman. Why is this important? Well, if it's a woman or a man, a child or an adult or an elderly patient, it's important. Number 2, second factor. What is the problem or healthcare needs? Well, the patient has right upper quadrant pain, right upper quadrant pain, radiating to her back. Her pain is 9 on the scale of 1 to 10. So we have determined the patient is a woman, and notice they are giving you more information that is important. 22 weeks gestation. It's important when they tell you the weeks of gestation, because that way you're going to know if it's in the first trimester, second trimester, or third trimester. Now, do I have subjective or objective data? That is extremely important to identify if it's subjective or objective data, especially once you start using the assessment versus implementation strategy. So you need to learn how to identify these key factors before you start applying those strategies. So do I have subjective or objective data? In this scenario, I have objective data. I will tell you why it's objective in a little bit. Other keywords are, it says that the pain is 9 and it has occurred 2 times in the last week for about 4 hours at a time. So it's a pain that is prolonged. It's not a quick pain that comes and goes. It stays for a while. Another important word is that the pain is not associated with food intake. And then the last key point is that this question is a priority question, because the keyword is highest priority. Why is this important for me? When you see that the question is a priority question, you have to use a prioritization strategy to answer that question. If you see that it's a content-based question, then all you have to use is content. Easy. But when it says highest priority or other keywords that indicates prioritization, you have to use a strategy. Otherwise, you're not going to answer correctly. Let's go into a little bit more detail on the patient. If they tell you the patient's age, gender, ethnicity, religious belief, mental status, that is important. Nursing care is not the same for a pediatric patient than an elderly patient. It's not the same for a female or a male, for a pregnant female versus a not pregnant female. If it tells you that the patient is Jehovah's Witness, it tells you about the religion, that is important. If it tells you that the patient is confused or alert or lethargic, that is important as well. So you have to identify who your patient is and what is the status of your patient. What is the clinical picture scenario or clinical manifestations? If they tell you what the scenario is, that is important. For example, if it tells you that the scenario takes place after a plane crash and there are multiple victims, that is different than if you're doing a triage in the ER with one patient. Why is that important? Because prioritization changes when there is a mass casualty event versus a non-mass casualty event. So that is an example of why it's important to identify this. What are the patient's symptoms, subjective or objective? And we have to go a little bit deeper with this because in nursing school, they have taught us that if the nurse sees it, is objective. And it is true, but I'm looking more about the symptoms and the data that the question is giving us. And I want you to think about it this way, especially for the assessment versus implementation strategy that you will learn later on. If it is described by the patient, okay, or not observed by the nurse, it is subjective. Now, objective data is observed by the nurse, but in parentheses, measurable. That is important. If you have data on the stem of the question that is measurable, is numeric, you can tell the place value, that is an objective data. Why is this important for you? Because in scenarios where the information that they're giving you is subjective and it's not clear, most of the time the answer is going to be an assessment. Versus if you see a scenario that you have objectable data, okay, measurable data, especially when you have objective data and an emergency, usually the answer is an implementation. Why am I saying usually? Because we cannot generalize in anything on the NCLEX world, but for the most part, when we see those scenarios, the answer is implementation. If you have a measurable data and is an emergency. Understanding the style of question is important. Like I said, if you see that the question is a priority, then you have to identify what priority strategy you can use. But Professor, how can I determine that I am in front of a priority question? Well, you're going to see keywords like priority. Which patient is a priority? What is the priority nursing action? Now, there are scenarios that you don't see the word priority and still it's a priority question. For example, a patient arrives in the emergency department. A patient arrives by ambulance. A patient is returning to the floor. What is the most important intervention? The word most important is a priority. What patient should the nurse see first, call first? That is a priority style of question. There are common keywords that indicate the need to prioritize. Example, these words: essential, first, priority or highest priority, immediate, initial, most important, most likely, next, primary, vital, most appropriate. If you see these keywords, it's telling you that you're probably in front of a priority question. And whenever you see that, you're going to tell yourself, okay, what priority strategy can I use? Assessment versus implementation, Maslow's hierarchy of needs, DSAR method strategy, the doctor strategy. There's a bunch of prioritization strategies that you can learn.